Hello, everyone, and welcome to today's program. As flu season arrives, discussions about the antiviral Tamiflu are heating up once again. Recently, a claim has been circulating online that the raw material for Tamiflu comes from star anise. Some social media sources even suggest that simply soaking star anise in hot water and drinking it can provide the same anti-flu effects as Tamiflu. This idea sounds natural, affordable, and quickly attracted widespread attention. But is it really true? Is star anise truly a natural Tamiflu? In this episode, we will look at the mechanisms, production process, and scientific evidence behind these claims to uncover the real story. Tamiflu, also known as oseltamivir, is one of the most widely used antiviral medications worldwide for treating and preventing influenza. It was developed by the Swiss pharmaceutical company Roche, received regulatory approval in 1997, and officially entered the U.S. market in 1999. Over the years, extensive clinical research has confirmed that oseltamivir is effective against both influenza A and B, especially against multiple subtypes such as H1N1 and H5N1. It is also used for post-exposure prophylaxis in high-risk populations. To understand how Tamiflu works, we must first understand a key viral protein, neuraminidase. Neuraminidase sits on the surface of the influenza virus and acts like a pair of scissors during viral replication and spread. After the virus replicates inside human cells and new viral particles mature, neuraminidase cuts the connections between newly formed viruses and the host cell, allowing them to be released to infect additional cells. Because of this essential role, neuraminidase has become one of the most important targets of modern anti-influenza drugs. Tamiflu is a classic neuraminidase inhibitor. After entering the human body, the drug is rapidly converted into its active metabolite, oseltamivir carboxylate. This active form precisely inhibits the neuraminidase activity of influenza A and B viruses, essentially locking the exit and blocking newly formed viruses from escaping infected cells. By cutting off the viral transmission chain, this mechanism helps reduce symptom severity, shorten the duration of illness, and lower the risk of complications in certain populations. The development of Tamiflu did not happen overnight. The story begins in 1991 when a small Australian biotechnology company called Biota first filed a patent for neuraminidase-derived antiviral compounds. Later, Gilead Sciences in the United States took over the research and optimized candidate molecules to improve antiviral activity and bioavailability. But during development, the team encountered a major challenge. The supply of conic acid, a raw material needed for synthesizing the drug's key chemical backbone, was extremely unstable and insufficient to support future large-scale production. It was under this context that researchers at Roche and Gilead turned their attention to another natural compound, shikimic acid. In 1993, Gilead officially switched to using shikimic acid as the starting material for a new generation of neuraminidase inhibitors. Though it seemed like a simple adjustment in the technical route, this shift later proved to be a critical turning point that allowed Tamiflu to achieve scalable industrial production and reach the market. By 1996, Gilead and Roche formed the Global Influenza Partnership, pushing oseltamivir through clinical trials and successfully commercializing it. Why choose shikimic acid? The reason lies in its structural and chemical advantages. Shikimic acid provides a cyclohexene-type chemical framework that closely mimics the transition state structure used by neuraminidase during its enzymatic reaction. This structural simulation allows Tamiflu's final molecular form to bind efficiently and stably to neuraminidase, enabling precise inhibition of viral release. From a synthetic chemistry standpoint, shikimic acid offers an ideal starting point for constructing Tamiflu's complex molecular architecture. One of the primary natural sources of shikimic acid is star anise. It is also present in ginkgo, spruce, pine, and fir trees. Because star anise is widely cultivated, it eventually solved the supply bottleneck for shikimic acid. During the avian flu outbreak in 2005 and the global H1N1 pandemic in 2009, demand for Tamiflu surged dramatically. At its peak, the drug brought Roche over $1 billion in annual sales. To meet global stockpiling needs, It is estimated that up to 90% of the world's star anise production at that time was used to extract raw materials for Tamiflu. However, transforming star anise into Tamiflu is far from a matter of steeping a cup of tea. Experts emphasize that extracting shikimic acid from star anise is a highly complex and not very efficient industrial process. On average, about 30 kilograms of star anise are needed to produce just 1 kilogram of shikimic acid. The extracted shikimic acid then must undergo a series of precise chemical reactions, first converted into an epoxide intermediate, then the ring is opened, followed by atomic rearrangement to form an azide compound, which is subsequently transformed into the final active pharmaceutical ingredient. Afterward, this active ingredient must be mixed with multiple excipients in strictly controlled ratios and dried under vacuum conditions before it becomes the Tamiflu capsules, or granules, that we take. For this reason, even though star anise truly contains the precursor molecule needed for Tamiflu, shikimic acid, directly consuming star anise or drinking star anise tea cannot prevent or treat influenza. Pharmaceutical formulations require precise extraction, structural modification, and dosage control under highly regulated conditions. Shikimic acid itself is not the same as oseltamivir. There are still multiple complex synthetic steps between them. Simply soaking star anise in hot water or using it in cooking cannot trigger these chemical transformations, nor can it produce oseltamivir, the molecule with actual antiviral activity. Therefore, it is impossible to achieve Tamiflu-like effects through star anise tea. Does this mean star anise has no health benefits at all? Not exactly. Studies show that star anise does have certain antibacterial, antiviral, anti-inflammatory, and antioxidant properties. As a spice or herbal drink, star anise tea, like other warm herbal teas, may help soothe throat discomfort, reduce nasal congestion, and support hydration, which can aid recovery during a cold or flu. However, these effects mostly come from aromatic oils and other active compounds in star anise, not from shikimic acid. Even though some experiments show that star anise extracts can inhibit certain viruses in test tubes, there is still no solid clinical evidence to prove that star anise tea can prevent influenza, treat it, or shorten its course the way Tamiflu does. From a safety standpoint, occasional small amounts of star anise tea are usually safe for most healthy adults. However, caution is necessary because some commercially available star anise has been found adulterated with Japanese star anise, a toxic plant that can cause nausea, vomiting, seizures, and central nervous system disorders. More importantly, cases have been reported in which infants developed poisoning after consuming star anise tea. Therefore, star anise tea should not be given to infants or young children. Individuals allergic to anise-related plants or those taking certain medications should consult a doctor before drinking it. In summary, the online claim that star anise is equivalent to Tamiflu is essentially a misunderstanding, or even a distortion, of pharmaceutical science. Pharmaceutical companies use star anise because it is an important natural source of shikimic acid, which is only one precursor in the synthesis of oseltamivir, not the final antiviral drug molecule. A cup of ordinary star anise tea contains only trace amounts of shikimic acid, and everyday cooking or brewing conditions cannot trigger the necessary chemical transformations. Without industrial-scale synthesis steps, no biologically active anti-influenza drug will form. Therefore, star anise tea cannot replace Tamiflu and should not be used as a method to prevent or treat the flu. Of course, as a traditional spice and herbal plant, star anise may offer certain supportive wellness benefits when used appropriately and is generally safe for most adults. But when facing an actual influenza infection, scientific and standardized antiviral treatment remains irreplaceable. That concludes today's episode. If you found this content helpful, please like the video, subscribe to our channel, and turn on the notification bell. Thank you for watching, and we'll see you next time.